Georgia's public health department says there has been a slowdown in COVID testing and in the number of positive cases.
And while that may be a sign that we are headed in the right direction, CBS 46's Karen Greer spoke with local public health workers who say they're not so sure.
Here at MAJL Diagnostic Laboratories, COVID testing has dropped 50%.
We were doing close to 1,000 tests a week. Now we're at 500. Why? I think because the media or the politicians are putting it out there that we don't necessarily need to be tested. And if you look at the current guidelines, the guidelines stress that.
Those guidelines are the CDC's recent changes that now say asymptomatic people should only be tested if they are vulnerable and have come in close contact with an infected person for at least 15 minutes. Dr. Darren Noggles is Chief Medical Officer of Elite Medical Group, which oversees the lab.
I think with the guidelines, it can lead people to a false sense of security.
6 months into the pandemic, testing remains an obstacle, from a limited number of sites in the earlier months to delays in results, backlogs over the summer. And as flu season approaches, there's now concern over supply shortages. Lisa Nicole Cloud runs operations for the lab.
I believe that if every laboratory in this country was testing at max capacity, we still wouldn't have enough instrumentation to be able to run all the necessary tests.
Cloud says certain testing instruments and reagents, the chemicals used in those test kits, are continually on back order.
Some equipment on order since April.
Georgia's Public Health Department says despite a decrease in testing statewide, COVID cases continue to decrease, touting an 11.7% drop from September 1st through the 8th. More than 6,000 Georgians have died from the coronavirus.
Obviously, we want things to look like things are getting better, but for some populations that are at higher risk of mortality, I don't think we should be playing with people's lives.
Public health workers like Dr. Colin Smith believe a perfect storm could be brewing despite those numbers.
I'm not going to lie, I am concerned.
Smith, a professor at Georgia State University, says the Atlanta-based CDC's unexplained tweak in guidelines is troubling, and that it's time for Georgia to rethink its own.
Individuals not engaging in the same level of testing. You have a lack of emphasis on the constant messaging in terms of wearing masks, washing hands, engaging in 6 feet distancing. Maybe we will have to go and strengthen the recommendations so that we align with what we're supposed to potentially be doing.
Cloud tells me some manufacturers have warned she will not get the equipment she needs until next year. And then delays in mail service are also creating a backlog. Karen Greer, CBS 46 News.